Dr. Niro Sivathasan and Dr. Stanes here to talk to you about double chins. It's not uncommon for us to see patients who present with a lot of volume under the chin, quite distressed about the way they look, the lack of definition. They feel they look a little bit heavy, they've lost definition. What are the options? Of course, we have surgery, liposuction, or as part of a neck lift we can cut some of the fat out. The alternative, of course, is a non-surgical approach. Aaron, what are your thoughts?
So the non-surgical approach has a number of benefits in terms of affordability, lower downtime, you don't have to wear a garment over the area for a few weeks. So I guess the question is, how do you know who to go to or which option is best? Now, many clinics do offer fat dissolving injections, which again, it's a walk-in, walk-out procedure. However, something that I've found through experience is that synergism is key, and it's something that I've always used as a guiding principle in my treatment. Typically, clinics will only address the fat itself under the chin, whereas in most people, they often need a combination of fat reduction, muscle relaxation, and skin tightening. And so when I offer my treatments, I like to tailor a plan that addresses all of those areas. I find if you do it in that way, you get a much better result. And when you approach it from more of a medical perspective, you can make it a very tolerable and comfortable procedure that only takes a few minutes.
The other thing that we can throw in, of course, is once this is debulked and the neck and chin area looks sharper, we can do silhouette soft thread lifting to further improve the contour of the jawline.
And so that's something that at Ignite Medispa we've really been proactive about, is treating the face as a whole and treating the face in context with the person behind it. And using multiple different types of treatments together means we can achieve natural results that look better and last longer. The guiding thing that we've done at Ignite Medispa is to use synergism and multiple treatment modalities so that we can achieve more natural, long-lasting results with, again, lower downtime, and that's compared to traditional means with just using a lot of dermal fillers or anti-wrinkle injections, which look good in the short term, but typically over time tend to look quite odd.
I agree. Synergism, great way of expressing what we try to do, where 1 + 1 is not 2, it's 3. So the outcome of adding different approaches is actually more than just the individual components. And you've also touched on another very important point. There is a tendency over the last year or so for people to add a lot of volume to the jawline. People are, especially for a lot of women, they're getting a lot of fillers added there. In my opinion, and you probably agree with me here, that takes away the lovely female silhouette, the appearance of being less heavy around the neck area. And all it does is it just adds more volume and weight. And whilst this might look initially good, I think it does take away from what we should actually be doing, which is basically returning a lady's face back to having a soft V or a U or a heart shape.
Delicate.
So this is the kind of thing where one has to think about the way the different components will work together and give a superior result.
And this approach typically shows a misunderstanding of how faces age. Pumping lots of dermal filler into an aging face that has stretching skin is only going to make the face bigger. We should keep the face proportionate to the body, and that's where I'm a very strong advocate for skin tightening. Something I have myself, it's something I recommend to all of my patients and my friends and my family, because if we keep the skin tight, we can use less dermal filler, we can get better results with threads, and it really boosts the results that we can get with all of our other treatment modalities that we offer.
The skin is almost like a tablecloth on the table. So as we age, the size of the table decreases and the tablecloth increases. So not only do we have to build up the bone or the table, we have to also tighten and shrink the overlying skin. And this is the kind of thing that we take pride in discussing and guiding our patients about. Come and see.